Hello, my name is Frank Hood, and I'm the manager of hepatitis advocacy at the AIDS Institute. And I'd like to thank you for joining us for this Hepatitis Appropriation Partnership Hill Advocacy Training. Today, I'm going to be discussing Hepatitis 101, going over the stats and what's happening on the ground around each of the viral hepatitis. In the US, the public health focus on viral hepatitis is primarily on hepatitis A, B, C, and D, although there is also a hepatitis E. Viral hepatitis is a viral infection of the liver that can cause inflammation, psoriasis, and left untreated can lead to liver failure and cancer. Liver cancer is one of the cancers that have seen the largest increases in the past few years and is one of the deadliest cancers around. Viral hepatitis prevention is cancer prevention through and through. And so it is important that when we think about viral hepatitis prevention, we are thinking about not just ending or preventing an infectious disease, but preventing the long-term health consequences of that disease. And in this case, it's liver failure. So it's very important that where available, that vaccines be provided, and when able, those who have been identified as living with hepatitis B and C, or A, B, and C, that they be linked to treatment. Hepatitis A is passed through when the virus contaminates food or through other close contact. It is vaccine preventable, and it is acute. There is not a chronic hepatitis A. Unfortunately, in 2019, there were nearly 40,000 cases, and in fact, cases have increased more than 1,300% since 2015. It used to be that hepatitis A outbreaks were things you would see in buffets or cruises, but instead we've now seen massive outbreaks, primarily occurring among individuals experiencing homelessness in large encampments, as well as among those who use drugs. And that's really been driving the spike in outbreaks in these states. Hepatitis A, those infected it can be deadly. It causes severe flu-like symptoms, and much like the flu, those living with other conditions can be at risk for death and other concurring conditions. Hepatitis B is bloodborne. It is also vaccine preventable, although it can become chronic. Cases tend to be acute when you're an adult, although if you acquire hepatitis B in your youth, you have a much higher chance of having a chronic infection. Currently, in 2019, we saw just over 20,000 new cases, and that number has remained fairly level for much of the last decade after years of declining numbers as the vaccination efforts to prevent new cases suddenly met a driver of new cases in the opioid crisis. Additionally, hepatitis B is an area that we have a significant number of individuals who are unaware of their status. About 2/3 don't realize that they are living with the disease, mainly because it can be asymptomatic. And oftentimes individuals' liver failure is sometimes the first symptom that presents, a symptom from a liver failure is the first symptom that presents that something has been wrong. Also driving down the lack of awareness is great discrimination and stigma that occur against individuals living with hepatitis B that may prevent them from reaching out or talking to loved ones about their risk factors or seeking medical attention. We have seen a shift in new cases as a result of injection drug use, with more than 1/3 of new cases occurring with injection drug use as a risk factor. And hepatitis B is important to prevent because hepatitis D requires hepatitis B to exist as a transmission vector. And so individuals living with hepatitis B are at risk of also acquiring hepatitis D. And so hepatitis B prevention is also hepatitis D prevention. And again, in this case, a situation where treatment as prevention also works. Hepatitis C is the viral hepatitis that has had the most number of cases over the last decade. It is also bloodborne, similar to hepatitis B. There is no vaccine for hepatitis C, although it is curable. New direct-acting agents that have come onto the market over the last decade can cure hepatitis C in as little as 8 weeks with a once-a-day pill that has little to no side effects and a cure rate close to 95%. Despite this, though, we still saw a significant increase in new cases, with more than 57,000 in 2019. That is a nearly 500% increase since the beginning of the decade in 2010. And approximately 2.4 million people in the country are currently living with hepatitis C. Again, awareness of individual status is an issue, with more than, or just about half of individuals living with hepatitis C unaware of their status. This has also been infectious disease that has bore a significant brunt of the opioid crisis and the increase in injection drug use, with a significant shift of new cases coming as a result of injection drug use, about 2/3 of new cases. And this shifts from existing new cases that were primarily being found among older adults that had acquired hepatitis C through blood transfusion or in unsterile medical or tattoo practices in the past, before more was known about the hepatitis C virus. Whereas that burden was really popping up among baby boomers, we're now seeing new cases really popping up among individuals under 40, which really coincides with the population we see primarily having injection drug use in the US. And I mentioned hepatitis B earlier, although there is not a column here. As I said, hepatitis B is a concern for those living with hepatitis B or at risk for hepatitis B. It is not a reportable condition, so we are unaware of the true burden of hepatitis B in the US, although it is considered fairly rare. Many cases in the US occur in immigrant communities. And so with a lack of surveillance and with where the virus exists, little is known about the true prevalence in the US. But it is important to note that hepatitis B prevention efforts do support hepatitis B prevention as well. And then while it is not viral hepatitis, I do have overdose listed on here because, as I've mentioned throughout, injection drug use and really the lack of sterile injection equipment has been a driver of viral hepatitis cases across the board for quite a few years now. This problem has continued to grow, and we are tragically now surpassed more than 100,000 overdose deaths in a year's time, which is a record. That record was also nearly a 30% increase from the year before, which itself was a record. And we're seeing that almost 60% of overdose deaths are results or are having fentanyl found in the drug that caused the overdose. And so as we approach overdose prevention through harm reduction, through syringe service programs, through naloxone distribution, that is a key intersection to also discuss and provide important programs around viral hepatitis prevention, testing, linkage to care, and really the programs that we use in the US to push for viral hepatitis need to also be pushing around substance use disorder and those who use drugs, and meeting them where they are, not having the end goal necessarily be treatment, but the end goal being drug use that prevents infectious disease spread and minimizes the risk of overdose death. I hope you found this session informative, and I hope that you take an opportunity to watch the other videos as part of this Hill advocacy session. And as always, don't hesitate to reach out to myself or other members of HAP as you work through your advocacy in the hepatitis space. Thank you.